Trial without catheter is what we call TWOC. Now, if your TWOC has failed before, this one step should change the outcome. Flip flow training. Most TWOCs fail due to poor bladder preparation, not permanent blockage. Removing the catheter without training the bladder sets many patients up for fail. I see it far too often in the hospital. With the catheter in, that gives you long-term free drainage. The bladder stays empty and passive. The bladder, which is a muscle, that will weaken. The sensation reduces and coordination is lost. So muscle weakness, no sensation, and no coordination, it's not a good combo. That will lead to failure, and it doesn't prepare you for a TWOC. This is where a flip flow valve catheter. Now this turns a catheter into a training tool instead of constant drainage. So the valve stays closed, your bladder starts to be used, and every 2 to 4 hours the valve is opened by the patient and the bladder empties fully. That repeated filling and emptying retrains the bladder stretch receptors. It improves detrusor contraction and restores normal voiding signals. This matters because studies show patients who use catheter valves for days to weeks before a planned TWOC have higher success rates, better bladder capacity, and lower reinsertion rates because the bladder has practice doing its job before the catheter is removed. Used correctly, this should be classed as bladder physiotherapy. Again, not everybody will be suitable for this. It does require good cognition, regular emptying, and monitoring to avoid over-distension of the bladder. But for the right patient, this flip flow valve transforms TWOC from a gamble into planned recovery. Preparation here is what makes a huge difference. Please speak to your GP or your urologist or your outpatient district nurses. They will be able to help you on this. Thank you for watching. Take care. Assalamu alaikum.